Now, this Labor Day, we celebrate the healthcare workers at the front line. At this time of the COVID-19 pandemic, many of them put their lives on the line, dedicating extra hours to care for patients and contain the spread of this virus. Dr. Samuel Kabereria, an infectious disease expert, has been a doctor for 17 years. In his 8 years specializing in infectious diseases, he says he has never seen a disease like COVID-19. But given a chance to change his profession, he would still be a doctor, serving and saving lives.
When we are at war with an unseen enemy, then the frontline soldiers are the men and women working in our healthcare facilities. To walk a mile in Dr. Samuel Kabereria shoes, you would have to have 17 years experience as a doctor, 8 of which he has been a tropical and infectious disease specialist. We meet him at the Kenyatta National Hospital's infectious disease unit at a time when COVID-19 infections in the country have surpassed the 400 mark.
In my life, I've not seen a disease like COVID-19. In fact, unknown to most people, we had started getting alerts as early as December. So during that period, we were having suspects for COVID-19 who were tested but turned negative. But sometimes we would even admit them at 3 o'clock. Those initial days, and when we also had the first cases, we ended up working almost 24 hours.
By the time Kenya was recording its first confirmed case of COVID-19, the situation outside Africa was at an exponential phase. Healthcare workers were getting infected and PPEs were in short supply. It was and is a novel virus, and even healthcare workers back in Kenya were preparing themselves to deal with containing the virus.
Most of the health workers felt like they were not confident, including ourselves. Because being considered experts, most of the questions about COVID were being put to us.
PPEs were of the essence. The lack of it, especially when coming into contact with infected people who had not been tested, proved detrimental at the early days.
Personal protective equipment for COVID-19 was more complex. Complex means more uncomfortable. Whatever you have to do it much faster, much more efficiently.
What most people don't realize is that the patient's anxiety, moods and outcomes have a great impact on the doctors and healthcare workers. Anytime a patient is in a depressing situation, this causes stress and anxiety in the doctor as well, especially if a patient still tests positive after 14 days of isolation.
The patient is so low, even you as a clinician, you are so low because you can't even explain to that patient because they are asking you, what is happening to me? How come other people are being tested and they are turning negative? So you have to think, maybe now use your knowledge.
I ask if he has ever broken down.
Not quite, but there are days you would feel you don't want even to go anywhere near the facility. Generally, there has been more stigma towards health workers. Some of their relatives have told them to visit them after the COVID pandemic is over.
But they also have their best days.
I can tell you the happiest day was the day we discharged the first COVID patient. Everyone was celebrating because we were saying at least our patients have survived it. Most encouraging was the one where the president said there will be a package. And of course, some of the counties also started saying they have a package for the healthcare workers.
Even after the pandemic abates, Dr. Njenga says infectious and zoonotic diseases will still be a new normal. Healthcare workers will still need more training and capacity to handle any other diseases of this kind. This work is never about individuals. It is always a team effort, from the support staff at the health facilities to the clinicians, the community health volunteers, the nurses to the doctors. The chain cannot be broken. There cannot be a weak link.
Even phone calls, if someone will make a call to you and tell you, we can see you are working very hard, we are very happy.
Dorcas Wangira, Citizen TV, Nairobi.